NARCAD webcasts, fresh content, expert speakers, and new ideas in the field. Hello, everyone, and welcome to Academic Detailing 101, the power of clinical outreach education. We're so excited you're joining us for this webcast today. I'm Bevan Amira, the Deputy Director here at NARCAD, the National Resource Center for Academic Detailing.
My name is Anna Morgan Barsamian. I'm the Senior Manager of Training and Education here at NARCAD. We're so excited to be with you all today and teach you why the interactive communication strategy of AD is so powerful and essentially why it really works.
You'll learn how you can use it to change clinician behavior, which ultimately improves patient care and the care of your community at large.
You'll also learn what a strong AD program looks like and how to get started and build one.
We're here for you every step of the way, whether you are just trying to check out what's the strategy all about today, or whether you are going to be somebody who is either managing a program from start to finish, or you'll be a detailer themselves going out into the field and speaking one-to-one with clinicians. No matter where you're at, we are here to be right next to you as you build a program. All right. So the first thing we'd love to ask you to do is just take a moment and do a thought exercise with us. Picture a busy clinician who's working somewhere in the States at this very moment. All right. If you've got a vision of that person, now we'd like you to ask yourself this. Think of 3 things at the top of that clinician's mind right now. We'll give you a moment. When we do this exercise live, Anna and I hear all kinds of responses, but there's always a common theme. They're stressed out. They're thinking about, how do I take care of this patient who's right in front of me and the 7, 8, 9 other patients who are waiting in the waiting room? I'm running behind. When am I going to get a chance to eat lunch? What else do people think about? I want to ask Anna this question because she's a nurse. Anna, what do you think about when you're in the middle of a shift and things are pretty crazy?
Always thinking about documenting and when I'm going to get it done, how long it's going to take to document all of the patients that I've seen, make sure I'm not forgetting anything as I'm documenting too.
The thing about documentation is it really never ends, right? Because you're taking care of the patients in front of you. And as you said, you're charting for those patients, but you may have to document other things based on what kind of a role you're in, especially if you're working in a clinic where you need to prove that you are, as a clinic, improving on certain outcomes within certain metrics. So documentation never ends either. It's a full-time job.
So we know that clinicians are overwhelmed. And each year, over 1 million new papers are added to the PubMed database. That's an overwhelming amount of new information for healthcare clinicians to sift through each day. Now, this translates to approximately 2 papers published every minute, or about 3,000 new studies entering the literature every day. Even if a clinician had unlimited time, they would struggle to read and assess all of this information. The issue is not just accessing research, but determining which evidence is the most reliable and relevant to the patients that they are serving. Clinicians need trusted sources and structured approaches to integrate the best available evidence into their practice. And Bevan will walk you through what that looks like in detail.
So as Anna said, clinicians are overwhelmed, but even having the best evidence right in their hands is often not enough. As Anna said, if they could freeze time and read everything there is to read, they still need to make sure that the data that they're curating applies to them. So with all of that data coming out, all of that literature, you're definitely going to be interested in different content if you're a pediatrician versus a geriatrician. You're also going to need time to take that stack of papers that you've frozen time to read and translate them into things like checklists, risk calculators, things that are practical and usable right now. On top of that, I don't know about you. I know about Anna and myself. We need to be able to ask questions, look at visuals, and really interact with new information to learn and learn well. You can't just read paragraph upon paragraph of data and expect to be able to apply it without asking questions. And on top of that, you're going to need support as a clinician to figure out the different ways you might be able to apply that data and fit it into your current practice. All of this sounds like so much more is needed than just time. Clinicians need someone at their side.
And that's where AD comes in. So there's often a disconnect between the latest scientific research, which is on the left boulder here, and what's happening in current real world clinical practice, which is on the right boulder. Healthcare providers face challenges in keeping up with the rapidly evolving evidence and applying it effectively in patient care, causing this huge gap between the two boulders. AD serves as a bridge between research and practice. It provides clinicians with synthesized, unbiased, and evidence based information tailored to their exact needs.
So, we'll tell you a little bit about what that actually looks like. What is academic detailing, or AD, as you've heard us mention it? It's one-to-one educational outreach just for clinicians. The visits between a trained detailer or public health educator, lots of different terms for detailers, but no matter what the term, those visits last around 20 minutes on average, sometimes a little more, sometimes a little less. The great thing of many great things about academic detailing, and as you can tell, we're big fans of this strategy, is that it incorporates an individualized needs assessment. So a detailer is going to go in and approach each clinician a little differently by asking open-ended questions to get that clinician talking and engaged, sharing stories and experiences about what's working well for them and where they need support, extra information, knowledge, ways to apply that knowledge. And as you'll see in this image here, we have a clinician on the left-hand side being engaged, we hope interactively, as is the strategy, by the detailer on the right with some interactive, compelling graphics. Those are also called detailing aids. And whether they're in a paper format or they're on a tablet or phone, they should be graphically compelling, taking complex data and turning it into something that clinicians can really digest. As we mentioned, it's always an interactive approach. Nobody likes being lectured at, and a busy clinician who's running around wondering when they're going to get a chance to grab a coffee doesn't need someone coming in for 20 minutes telling them how to do something differently. Instead, it should always be a dialogue where the detailer is getting the clinician to speak a lot more than the detailer themselves. So no lecture. And there are always specific goals, which is going to tell you about.
So, the first goal of an AD visit is to assess where the clinician currently stands, including understanding their existing knowledge on the topic you're detailing on, their attitude towards evidence based recommendations, and their current clinical behaviors. By identifying gaps and challenges, detailers can then tailor the conversation to be more relevant and impactful. AD is not a one way conversation, as Bevan was saying. It's not a lecture, it's interactive. So, detailers focus on actively engaging the clinician through discussion, questions, and addressing any concerns that come up. As the conversation progresses, detailers continuously assess the needs of the clinician, adapting that conversation as they go to ensure that they provide the most useful and relevant information to the clinician that is sitting right in front of them. The ultimate goal of AD is to encourage meaningful behavior change. This is done by delivering clear, actionable, and evidence based key messages that clinicians can easily integrate into their practice. By emphasizing practical steps and offering support as a detailer, detailers can increase the likelihood of lasting behavior change that positively impacts patient care.
But it's also bigger than just behavior change, bigger than one moment or one change in practice. It's also about relationship building. And this is why a trained educator can be such a potent element to ignite that behavior change, so much more so than going online and looking up a piece of literature. Having a human to human approach really matters. And with that goal for behavior change being at the end of each visit, there's also other ways to measure success with academic detailing. Sometimes success looks like a clinician not being quite ready to try something new, but wanting you as a detailer to come on back and share more information, either with them one to one, with the rest of their staff, or finding ways to train those staff members to do some of the things that detailers ask them to do. Over time, though, the biggest goal is to have a healthy, trustworthy relationship with your clinicians with whom you're meeting. So if you're a great detailer, they're changing their behavior, but they're also looking to you as somebody at their right hand to really help them understand the new evidence and guidelines that are coming out minute after minute each day, and how to apply them in ways that really work for them and their unique practice setting. It's really a unique approach to behavior change. And there are so many reasons why it's such a successful approach to really making things better for patients. Anna's going to tell you more about why it works the way that it does.
Most of the time, AD is a voluntary service. So, unlike required trainings or webinars, clinicians can choose to participate, making them more engaged and open to discussion. This allows for a more receptive learning environment. Each visit is tailored to the individual clinician's needs, like we talked about. It's also tailored to their practice setting and their patient population. There's no one size fits all script. Every interaction is guided by the clinician's priorities and challenges. AD is also built on trust and genuine human to human connection. It's not about delivering a lecture, but rather having a conversation, understanding concerns, and working together toward solutions. Clinicians are more likely to be receptive when they feel heard and respected. Effective detailing isn't just about sharing information, it's about truly listening. By using active and reflective listening techniques, detailers can address those concerns that come up. They can clarify misunderstandings and reinforce key messages in a way that resonates with the clinician. AD also allows for flexibility in messaging, timing, and delivery to meet the clinician where they are, whether it's adjusting the level of detail or time for the visit, adjusting the setting of the visit. For example, is it in a lunchroom? Is it in their office? Is it outside? AD is always adaptable and customizable. Unlike traditional models, the success of AD is not measured by checkboxes or rigid metrics. Instead, it's about building lasting trust based relationships, as Bevan mentioned, that lead to meaningful behavior change over time. The idea is that when clinicians feel supported rather than, say, evaluated, they are more likely to engage and implement new practices.
And you may wonder, well, when do metrics come in? Hang on, and we'll tell you a little bit more about building a program in a few slides. For now, we're going to ask you to do another thought exercise. Take a moment and think about the first words that come to your mind when you hear the phrase sales representatives. We'll give you a moment there. But I know when we do this live, we have a lot of different responses. Anna, what are some of the ones that come up most often when we do this exercise?
Slick, or there's often food involved, or excellent communicators.
We often hear money, 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 right? That there's a goal for commercial sales, which is just a fact when it comes to sales representatives of any sort. You can think about the pharmaceutical industry, or even someone who's trying to sell you a car or a watch. There is a goal in mind, and it's typically not to make sure that you have a great relationship with the sales representative. So keep that in mind in any of the first reactions that came to your mind as we move towards this next slide.
So we're going to ask you to do this again, but we're going to give you different words to think about. So think of the first words that come to mind when you hear researchers and academics, and we'll give you a moment. When we do this live, many folks will say evidence-based medicine, research trusted sources of information, or they might say boring or out of touch, they're in an ivory tower. We hear things all over the map for this one as well. Bevan, what else do we hear?
Sometimes folks aren't particularly nice and they say stuffy, dry, nerdy. Same thing with the ivory tower piece, being out of touch or not understanding what's actually happening on the front lines of something, right? There's a big gap between what researchers are thinking about and what's happening in the real world. So think about these two sides of a coin, and we're going to show you how the best parts of both of these worlds make up what we like to think of as the complete academic detailer. We take the best of both worlds, sales and academia. We start with sales on the left, and we grab the skilled communication of a sales representative. No matter how you slice it, a pharmaceutical rep, a car dealer, anyone in the space of sales, if they're good at their job, they're fantastic communicators. They ask good questions, they get a sense of who you are and what you need, and they try to deliver what you need right to you. Then on the right in blue, we've got research or academia. What we're going to steal from that is the trustworthiness of the work that they're doing, the evidence that they are curating, that they are studying. And we're going to marry these two pieces together. And that's where we get academic detailing, skilled communication of the truly best evidence out there.
We are going to do one more thought exercise here. So think of someone in your professional life with whom you have a strong relationship. Think of three things that make that relationship solid. I know that when we do this live, we hear trust, we hear respect, reliability. Bevan, what else do we hear?
Good communication, a sense of humor, the ability to be oneself in front of that colleague, to be genuine, to ask questions, and be in a non-judgmental space comes up often as well.
hmm So these elements that you're thinking of and that Bevan and I mentioned are all elements that a detailer will want to bring to a visit with a clinician.
Right. If you're going to be a detailer or you're going to be helping build a program of detailers, the relationship between detailers and their clinicians should be based on trust, reliability, great communication, and a space that's non-judgmental where a clinician can share what they're really thinking. If that space is created and created well together, a great detailer can really affect a clinician in more ways than just helping them look at their practice and make practice changes. They can also offer what feels like personal support amidst a stressful and sometimes impersonal, rapidly changing healthcare landscape. And they can offer clinicians the ability to step back for a moment and think about why they entered the healthcare space to begin with. Detailing, because of that human to human touch that Anna mentioned just a few slides back, really is uniquely poised to help clinicians reignite a sense of passion and purpose, which can really be such a buoy during a time of extreme burnout. It helps remind clinicians that they have the power to affect change, whether it's in a tiny way or a big way. No change is insignificant, especially for their patients. And last but certainly not least, a great detailer offers a clinician space to really move towards skill mastery in a specific content area. A lot of times, clinicians are just trying to get through, get their CEs, stay on top of their licensure. But a one-to-one session with another human who's there just for you as a clinician can provide that concentrated time to ask those great questions, to be in a live learning environment that's so much more palpably interactive than a lecture hall or a passive online webinar. So these are just some of the many reasons that clinicians can feel a lot more empowered to do their job and do it well after a detailer spends time with them.
So we walked through what AD is. Let's zoom in even more and talk about what an AD visit actually looks like. As we mentioned, every single AD visit is different. However, they should all include these 6 steps, which we will break down in just a moment. We have step 1, which is introducing yourself to the clinician. Step 2 is leading a clinician through a needs assessment, which will set you up for step 3, which is delivering a key message. Sometimes a clinician may not be on board with the information that you're sharing. So, step 4 is handling any objections or concerns that come up. Step 5 is summarizing your visit. And step 6 is gaining commitment to a specific practice change and closing your visit.
The first step of the steps that Anna just walked you through is a strong introduction. When a detailer walks in to meet with a clinician, the most important thing is the elevator pitch. It needs to be clear, it needs to be succinct, and it needs to be engaging. Whomever a detailer is meeting with, whether it's the clinician themselves or sometimes the practice manager, the receptionist, the office manager, needs to be intrigued. What's this all about? It sounds easy. You're just introducing yourself, right? But it does take practice. And Anna and I know after doing over 75 training sessions for the past 5 to 10 years that practicing an introduction isn't as easy as it seems. Once a detailer has introduced themselves, this is where it starts to get good.
And we move into the needs assessment. When detailers think about engaging clinicians effectively, they need to consider what they value, know, and need. Every clinician has personal and professional values that influence their decision making. Understanding their values helps detailers tailor their approach to resonate with the clinician's priorities. Clinicians also come with varying levels of knowledge and experience regarding the topic being detailed on. Some may be well versed in the latest guidelines, while others may rely on their longstanding habits. Finally, identifying a clinician's needs ensures that the detailer's recommendations are actionable and relevant to the clinician. They might need practical tools, they might need more time efficient strategies, or guidance on how to effectively communicate with patients about substance use. So, how do detailers find this out? By asking the right questions. Detailers need to be intentional in their questioning to uncover insights and use open ended questions that encourage storytelling. For example, instead of a detailer asking, "Do you follow the new diabetes guidelines?" Detailers could say, "How do you approach diabetes management with your patients? Tell me about a recent case that you had." By framing the conversation this way, detailers can gain a richer understanding of the clinician's perspectives, making their detailing efforts even more impactful.
I love that, Anna, and I love what you just modeled. The tell me about, talk to me about, anything that really gets that clinician talking is a great approach for a detailer who's trying to understand the values, knowledge, and needs of the clinician in front of them. So let's say a detailer has done a wonderful job introducing themselves and conducting a needs assessment. Next up is a key message delivery. So let's pause for a second. What's a key message? A key message is an action oriented and specific message that tells a clinician exactly what they might try incorporating into their practice. We'll give you 3 examples so you can understand what's a good key message. What does it look and sound like?
So here are our examples of strong key messages. We have screen all patients over 65 using the gait and mobility test. We have offer treatment options to patients with substance use disorder and use a standardized sexual health history questionnaire to determine which patients may benefit from PrEP. You can see that they each begin with an action verb in orange. We have screen, offer, use. These key messages are clear and concise and tell the clinician exactly what should be done.
I love it. Being clear means there hopefully won't be any confusion, but sometimes there's hesitation. Sometimes a clinician says, wait a minute, I don't think I can do this. And there could be so many reasons why. We spend a lot of time at our 3-day training talking about the myriad reasons why a clinician just might not be on board yet. It could be that they think they don't have time, that they don't believe in this approach, that they don't think it'll work with their particular set of patients. But whatever the reason is, a good detailer will pause and really listen, preparing to respond effectively by validating that clinician's concern and truly empathizing with it. Even if it's something as simple as not having enough time, it's really important to maintain that person to person connection. Once a detailer has really empathized and maybe used reflective language and reframing, that's when it's time for the detailer to ask more needs assessment questions to better understand on a deeper level what the clinician's day to day challenges are and what that clinician's unique perspective is about the key message that the detailer has attempted to deliver. Once they've gotten even more investigative journalism under their belt, that's when a good detailer will try a different approach, either reframing the original key message in a way that's more palatable and accessible to that clinician, or trying a whole different key message that might make more sense for that clinician.
As a detailer wraps up a visit, they'll want to summarize the key takeaways and reinforce the most important points discussed during the session. Detailers should keep it brief and focused and think about what they want a clinician to remember after they leave. Then, detailers should ask for a commitment, encouraging the clinician to commit to a specific action that is based on the discussion they just had. Detailers need to make it realistic and tailored to the clinician's practice. Ending with a clear summary and a specific commitment makes the detailing visit go from just exchanging information to taking action to better patient care.
So that's a visit in a nutshell. But there's so much more to academic detailing than just the one-to-one visit. Anna and I are going to walk you through the steps of building a strong program, some things to consider when you're starting to plan an intervention. The first thing you'll want to think about is what's the gap in clinical care and how do you know? What data are you looking at? Are you looking at prescribing data? Are you trying to bridge a gap in terms of patients not receiving the amount of screening that they need? Whatever the case may be, make sure you're doing your research first to figure out exactly what gap needs to be bridged.
Next, you want to think about the goals of your intervention. So, what's the change you want to see in clinician behavior? Goals should be clear, they should be measurable, and they should be aligned with best practices and guidelines. For example, your program goal might sound like increase the use of evidence based smoking cessation treatments among primary care providers by 10% within 6 months.
Such a clear goal. I love it. You're also going to want to make sure you have the right crew of detailers to make sure that that goal can become a reality. So you'll want to think about who you want in the field and how you can find them. We can help you with both of those steps.
The next step here is one-to-one visits with the frontline clinicians. So, who are you detailing? Are they primary care providers? Are they specialists, pharmacists, nurses? How many visits will be conducted? This can be across the intervention period or the number of visits with each clinician. What's a realistic goal given the time and resources that you have? And finally, how long should each visit be, or how long will your intervention be out in the field?
Lots to think about. As you're going along with executing your program, you're going to want to be tracking data all along the way. This can be looking at whether or not your goal data has shifted, have prescriptions changed. But you'll also want to be collecting data from your actual visits, tracking which key messages were delivered, tracking follow up visits. And that will all be information that will be used in creating your evaluation report. If you're feeling overwhelmed about this section, you're in good company. A lot of people in our field have been new to this and have been overwhelmed by data tracking and evaluation, but we've got tools to share with you to make it a little less daunting.
The last step here is about building capacity and sustainability. What's the long term plan for maintaining and growing your program? Identify funding sources, partnerships, and internal champions who can advocate for continued support of the AD program. Also, consider expanding to new clinical topics or clinician groups based on emerging needs in your own community. Remember, we can help you with all of this along the way. So let's talk about the amplified impact of AD in multifactorial interventions. AD does not have to exist in a silo. It can complement other healthcare initiatives. By aligning with existing efforts, detailers can maximize impact and build stronger partnerships. Many healthcare organizations already have QI or quality improvement initiatives in place, and AD can serve as a tool to reinforce these efforts by providing clinicians with targeted, evidence based support. Patient advocates and navigators play a critical role in bridging gaps between patients and the healthcare system. Detailers can align with their work by ensuring that clinicians understand patient needs, barriers to care, and available community resources. Community organizations often work on health education, they work on prevention and resource navigation. Detailers can connect clinicians with these efforts, creating a more holistic approach to patient care. Finally, health systems, payers, and professional organizations also often have priorities that overlap with AD topics, such as improving antibiotic prescribing or decreasing opioid prescribing. By aligning detailing messaging with these priorities, AD can gain institutional support and increase adoption among a larger group of clinicians.
So you may be asking yourself, whoa, this is a lot. How do I even get started? Don't worry, we are here to support you. We're here to help you each step of the way as you build a program to ignite evidence based change.
If you haven't already been to our website, I encourage you to take a peek at what we have available for technical assistance. We have so much there on each of the drop down menus you can explore. And if you're not finding what you're looking for, please reach out to us at narcat@bmc.org and we will help you.
Check us out at narcad.org. You can see our program planning hub is a great place to get started and It helps you with the building blocks you'll need to begin thinking about designing a new program. We have so many pieces there curated from other programs, things we've built for folks. So you don't need to reinvent the wheel. You can borrow one.
We also have a training series that we offer quarterly. So if you want to get trained to be an academic detailer and walk through the steps of a visit and role play with expert facilitators, we are here for you. And you can find all that information on our website.
Please join us at a future class. Thank you so much for spending time with us today on our NARCAD webcast. We really appreciated spending some time with you, and we'd love to hear your thoughts.
Please give us feedback on this webcast. You can scan the QR code on the screen and tell us what went well and what didn't. We also welcome your ideas for future webcast topics. Thank you so much for being here, and we hope to connect with you soon.
Take care and stay in touch.